usually have modest funerals. But even then, the fact that sometimes we can't even go to bury our families, ask yourself a question: what type of youth are we generating, and what kind of effects are we going to start seeing 20, 30 years from now, when these young people are grown-ups and adults running our country and running our institutions? So we couldn't have done better than focusing on the impact of COVID-19 on youth during Youth Month. The other issue also, of course, that you are highlighting here and has been highlighted by Professor Sifunda, is the impact of COVID-19 on teaching and learning. It's young people. And in particular, I am concerned about the impact of COVID-19 on first-year students, because they are the ones who need to be on campus most. They are the ones who need to adjust from school to university. So it's very important that we are focusing on this, as well as the important message of young people as carriers of the virus. As Professor Aluwale was saying, human beings are the carriers of the virus. You can't say because young people do not get affected health-wise, therefore we should not focus on them, because they are often the ones who carry the virus into households and where they affect the elderly, their own relatives, some of whom unfortunately they end up losing. So I want to say then, as we commemorate Youth Day in 2 days' time this year, we are grappling with this pandemic of COVID-19. But what I want to say in brief, because of time, not because this is not important, I would really like to thank Higher Health, Professor Aluwalia, and your team, and the work that we have actually been doing to assist our entire post-school education and training sector to deal with COVID-19. And we have been having a tireless effort together with your volunteers in assisting us in dealing with COVID-19. And of course, I must congratulate CPUT, how we have been managing it. You know, low rates of infection and high rates of recovery. That is actually very important. To this end, also, I would say Higher Health did this by capacitating and built through numerous online and in-person training sessions across all our campuses, and established a network of over 49,000 capacitated individuals. And that includes frontline staff, student support staff, including residents, wardens, and other support staff, training management across all our campuses. And among these capacitated or trained individuals are over 12,000 student volunteers that have been working with Higher Health on the COVID response. You know, the other important thing about this, and thanks media for being here, because sometimes my dissatisfaction is that you tend to show the negative side of our sector than the positive side. So students are not only out in the streets. 12,000 student volunteers have been trained to actually handle COVID-19 and its negative impacts in our own institutions. And that is very important. And thanks to Higher Health for that. I won't go into the COVID cases. We have had a number of institutions where we've had cluster outbreaks, but we've been managing them so far. And thanks to the work of Higher Health. For instance, since mid-October 2020, a few COVID-19 cluster outbreaks have been experienced in several institutions in the Eastern Cape, KwaZulu-Natal, here in the Western Cape, Northwest, and Gauteng. And to address these outbreaks, Higher Health, along with our leadership from institutions, have assembled multidisciplinary investigation teams, which have included people from the World Health Organization, our Department of Health, the National Institute of Communicable Diseases, as well as other relevant institutions like the National Health Laboratory Service, to manage and contain these outbreaks through early identification of infected students and staff, identifying their contacts and appropriately assisting them by early isolation and quarantine, thereby managing to break the chain of COVID-19. I'm therefore very appreciative that Higher Health and HSRC, through the support from DHET, from the Department of Science and Innovation and the United Nations, have undertaken a study on the social impact of COVID-19 among post-school education and training sector youth in South Africa. Before I say something about this, I must also just say a challenge, Professor Aluwalia, to Higher Health. You have accumulated a lot of experience on student wellness. And the model of Higher Health, its advantage is that it seeks to deal with student and staff wellness comprehensively. So we are not only dealing with HIV and AIDS, TB, other diseases, we are also at the same time dealing with an important matter, which is mental health, which has been highlighted here. In fact, the tendency for us has been to count the dead, significant as that is, but pay less attention to the mental health implications of COVID-19, to those who have lost families, who have lost friends, who have lost colleagues in the workplace. I'm glad CPUT is attending to this, but also Higher Health, do us a favor. Your model actually should be the model of the rest of our health system. It shouldn't just be for higher education. Therefore, I think it may be important that you write about this, but also make videos and hold webinars on your model of comprehensive student wellness and its implications for handling pandemics. Science tells us that we have entered the age of pandemics. COVID-19 is not going to be the last pandemic. That's why, amongst other things, as government, we are now investing in building our local production and local development of vaccines, for instance, as the president was highlighting being at G7. And as the Department of Science and Innovation, I have been given the task to lead the effort in the local production of vaccines. But I'm very confident that I will achieve this task if there is CPUT and our other institutions around working together with us. Now, on these results that have just been announced, which I'm officially launching today, and they will be in the media publicly, Higher Health, again, partnered with the HSRC to provide and to undertake and to do the study. The survey, as it has been said, explored young people's experiences and perspectives on the social impact of COVID-19 on education and learning in South Africa. Which, of course, this included gathering of knowledge, attitude, and perceptions, as has been explained, of young people. From the results, we know that 53%, for instance, of the respondents thought they were at low risk of contracting COVID-19, and 15% perceived themselves as high risk. This is important information because it means we need to intensify education. We need to intensify campaigning. But I would like to say it's not a bad picture at all that is emerging, that we've managed as a sector to deal relatively well with the pandemic and also to manage the completion of the 2020 academic year, albeit most of it in 2021, but that is a very important achievement despite the unevenness, because COVID-19 has exposed the depth of social inequalities in our society. But the picture is not that bad at all. And if the study tells us that more than 75% of our students do not engage in alcohol, drinking, and smoking as a way of coping, that's a very strong foundation in building a sober nation. in building a sober nation. I need to underline that. And also to do away with smoking. Both things, by the way, which myself I have abandoned. Just as way of example. I'm now a true teetotaler, except that I don't drink tea. But I do drink my water, VC. Now, this gives us very important. Now, I want to urge all our institutions to study this report very closely. And also, I want to urge all the stakeholders, whether it be students or trade unions, in our sector and other staff, management, to study this report done by the HSRC working with Higher Health, so as to look at what is it telling us and what more do we need to do. Already on the 27th of January this year, I urged our institutions and Higher Health to mobilize and capacitate our own healthcare workers, staff, and final year health science students to volunteer to be trained and act as extra hands supporting the Department of Health, as it is impossible for the Department of Health on its own to vaccinate 40 million people. So it needs our support. I'm very proud of SIPUT. It's very rare that you hear Stellenbosch University being assisted by a University of Technology in handling its own challenges. That is very good. It means SIPUT is doing things that are very important and appreciated by our other premier higher education institutions. That is something that is very important. I don't know why you don't clap for yourself. Today, we are seeing the real SIPUT, not the SIPUT that often gets projected in public, as if it's a broken institution. It's not a broken institution. It is an institution that is very much alive. I also commend our institutions, all of them, and of course working with Higher Health, for the mobilization of healthcare workers, staff, and final year health science students who have volunteered and trained to act as extra hands. It's very interesting that your faculty or school, whatever you call it, of health, its staff, its students, have been part of the effort. In other words, you haven't locked yourself into your laboratories and into your lecture rooms, but we have said, we have got skills. We will start here at SIPUT. But what is also good is that you are doing something I'm always emphasizing, that as it has been said by the Vice Chancellor, if I'm not mistaken, or somebody else here, that universities must not be ivory towers. They are part of communities. In fact, ideally, universities must be what we call anchor institutions in the communities and in the regions in which they are located. The fact that we are vaccinating your retirees, as well as other 60 plus people through your university, is something also that is very important. Let me conclude. There's lots I can say, by the way. And I am very, as I say, truly bowled over. And I've got many takeaways, PAPCOs, to take out of today's engagement and exposure. But let me conclude by saying, I take this opportunity to thank, firstly, the Vice Chancellor and his senior management, Professor Nhlapo, for the good work that we are actually doing in this institution. And let me also thank all the CPUT staff, and indeed all our other post-school education and training institutions, for collaborating and working together with us. If we didn't work it together, we could have lost the 2020 academic year for many of our institutions. I am convinced. We put in a lot of hard work as the department. I must thank my own staff. But working on our own, without your cooperation, we would not have been able to do what. Also, by the way, one good example here is that we have a team, a task team, that has been managing COVID-19, which is very important. Let me also thank Professor Alwalia, Professor Sudin, and Professor Sbusiso Sifunda, the latter two being in the HSRC, for undertaking this study that I have been launching today. please continue to do more research, because research is most important. One positive thing out of the dark cloud, as the English saying goes, every cloud has a silver lining. The one silver lining out of all this is that people are beginning to understand science and the role of science. You know, when you hear people today talking and using some of the scientific terms, it means science, the role of science is becoming more and more known. And let's use this platform to educate our communities, our society about science, that to invest in space science, as I said in the beginning, is not just about space, but it's about improving our living environment where we are here in our Mother Earth. As I have said, thanks Higher Health for your model, which even deals with the impact of gender-based violence and femicide, which is another big pandemic that we have. We can't be a country if we are destroying our women. Simple. Me, I'm a proud mama's boy because I know what mothers can do. And by the way, without the mothers and without the women, a lot of what we are doing that is good in our country would not be happening. So to allow our women to be abused is to abuse ourselves as a country and as society. The fact that we are doing a lot of work, I'm pleased that on my side, I have released a framework for gender-based violence for all our institutions, and I'm hoping our institutions will translate this into their own institutional strategies, which are very important. But I mustn't forget the most important, our COVID-19 warriors that have been trained by Higher Health, our student volunteers. You are exemplary. By the way, you will never be the same, given the experience you are acquiring while you are studying about doing something concrete to make an impact and change the lives of your own colleagues and protect them from this virus. That is very important. Let's give our student volunteers, our warriors, a good round of applause. Let me end by saying, as you have been ably reminded, let's continue to keep on keeping safe, because our country needs you, and that we remain safe, we observe all the health protocols. But I must say, CPUT, we have set a very good example. I'm looking forward now to be visiting your vaccination center, so that practically also the media is invited, so that you can see for yourself that what we are saying here, how is it happening in actual practice. Thank you very much.
Well, we come out of that briefing by the Minister of Higher Education and Training, Dr. Blade Nzimande, on the impact of COVID-19 on students in tertiary education. And with that, we